Hello everyone, my name is Pharmacist Michael, and today I am going to talk about a drug called Cymbalta or duloxetine. So stay tuned, I'll be right back with you.
Welcome to Pharmacist Michael's Happy Healthy Living channel, where you will learn how to improve your life, one video at a time.
Cymbalta, or duloxetine, is an antidepressant which belongs to the SNRI class. This drug helps with depression by making more serotonin and norepinephrine available to the neurons in our brains. It accomplishes this by inhibiting the serotonin and norepinephrine reuptake pumps within the neuron itself. Cymbalta has more uses than just depression. It can also be used for neuropathy caused by chemotherapy or diabetes, fibromyalgia, generalized anxiety disorder, and stress urinary incontinence. The amazing thing about Cymbalta, in my mind, is its ability to fight pain. Cymbalta can fight not only neuromuscular pain, but also neuropathic pain. I once saw a pain specialist for the arthritis in my back who told me that 90% of his pain patients responded favorably to Cymbalta. How do we dose Cymbalta? Well, I recommend starting for most people with 30 milligrams per day. And after 1 to 2 weeks, we can increase that to 60 milligrams per day. The maximum dose of Cymbalta is 120 milligrams per day. But really, you have to remember that when you get to higher doses over 60, your chances of side effects increase. If you decide to stop taking Cymbalta, especially after taking it for 3 weeks or more, you should slowly taper off this drug for 2 to 3 weeks to decrease the chances of withdrawal. Discontinuation syndrome or withdrawal happens with Cymbalta as well as other serotonergic antidepressants. And the symptoms of this withdrawal are irritability, sadness, inability to sleep, anxiety, nausea, headache, and the telltale sign of discontinuation syndrome is electric shock-like sensations. Who should be careful when taking Cymbalta? Well, there are several types of patients who really should be careful. Anyone who has a condition which delays gastric emptying would be one. Those suffering from a seizure disorder would be another one. Those with cardiovascular disease, those with liver disease, and patients with bipolar disorder. Patients with bipolar disorder should be careful with any antidepressant because antidepressants increase the chances of pushing the patient into mania. What are the side effects of Cymbalta? Now, before I tell you the side effects, I want to be very clear that just because these side effects are listed does not mean you are going to experience them. In fact, there's a lot of people that take Cymbalta every day that have not experienced any of these side effects. But the reason I'm giving you this information is because if you start this drug and these things happen to you, it may be a sign that you need to call your doctor and be switched to something else. So here they are: dry mouth, stomach pain, dizziness, severe headache, weight loss. Now, I want to tell you that weight loss only happens to about 1%, maybe a few more than 1% of adults, but it is more common in younger adults and children. Weakness or tiredness, constipation, diarrhea, irritation of the nose or throat, excessive sweating, sexual dysfunction, a change in vision, an inability to urinate, seizure activity, and glaucoma. Now, all serotonergic drugs, and Cymbalta is one, also run the risk of serotonin syndrome. What is serotonin syndrome? Well, here are the symptoms of serotonin syndrome. Trouble with balance, agitation, severe headache, flushing, rapid heartbeat, tremors, and severe diarrhea. It is also important to know that serotonergic antidepressants can also cause bleeding, especially when combined with nonsteroidal anti-inflammatory drugs, antiplatelet drugs, or anticoagulants. So be sure to check with your doctor or pharmacist before starting Cymbalta if you are on any of these drugs. And also be sure to check for drug interactions with your pharmacist prior to starting Cymbalta, because there are several drugs that Cymbalta interacts with. So my final opinion on Cymbalta, I think Cymbalta is a great drug. It's good for depression, it's good for anxiety, and it's good for pain. It's non-addictive. It's a whole lot better than a narcotic analgesic, and it's non-controlled. It really is an amazing drug for pain, and we have used it a lot for pain, especially recently. So I'm going to give Cymbalta a thumbs up. It is a little hard to get off of. The withdrawal symptoms can be a little bit difficult to deal with, but I think it's worth the risk, especially if you have pain and your mood isn't that great. If you know anybody who takes Cymbalta or is thinking about Cymbalta or would benefit from this video, please send it to them. If you enjoyed this video, give it a thumbs up. This video is a direct result of one of my favorite TikTok followers who asked me to do a video on Cymbalta. So if you have a drug or anything medically related that you would like me to do a video on, please leave it in the comments. Please subscribe to this channel for more happy, healthy living information. My name is Pharmacist Michael. Be happy and be healthy.